All right, today we are going to start Chapter 3, Section 6, Preventing Physical Activity Injuries. Okay, we're going to look at how to protect them, also how to take care of them. All right, so looking at preventing physical activity injuries, we're going to look at tips for injury prevention. Okay, we've already kind of hit on some of these things. Okay, yes, we've talked about the doctor's visits, physicals, things of that nature. Be in shape, all right? Getting ready for an activity is always an important thing. You know, when you go out for the first day for an activity or sport, you shouldn't just step in like you haven't done anything for 6 months. You should actually go in with that you've actually done some physical activity. Yes, stay within your ability. You don't want to try doing things beyond your capability, right? And I think of this like people that are trying to skateboard. If you see like somebody do something cool on X Games and all of a sudden, yep, I want to try doing that next. If you've just picked up a skateboard, probably not the best idea to do it, all right? Proper safety equipment, make sure you have the equipment you need. I think of this as this, if you're going to play a game of volleyball, you don't show up and start, you don't show up the first day of volleyball practice without the knee pads and things you need and jump in and think you're going to do it. Make sure you have the equipment you need to stay safe and keep yourself, as safe as possible. Don't get me wrong, with any sport, there is a chance of injury that no amount of equipment in the world is going to protect you from, but you got to have the proper stuff. Next thing is report all injuries to your coaches, all right? Yes, I get a lot of injuries that I told. Some of them I look at the kid, okay, yeah, just taking it easy on it. Don't do much with it. Other things I look at it and go, yeah, you need to go see a doctor. Sometimes I look at kids and say, you know what, it's not that bad, just keep going, okay? And this is where I, as a coach, or a lot of us know the difference for different kids. Some kids, aren't, as nice to say, some kids are tougher than other kids, okay? I'm telling them that because I know them, I know what they're capable of. I usually saw what happened, or I kind of, if they explain what happened to them, we use our best judgment too at times. And if you are injured and you are sent to a doctor, we do not let you play until you give us a note saying you are cleared to play. Right now, with concussion protocols and things of that nature, that is the big thing. We cannot let a kid come back from a concussion unless the doctor has cleared them and they have cleared the protocol. All right, let's talk about some common injuries. All right. Some of them are going to really classified as two different things, whether they're going to be minor or major. In the minor injury categories, we got soreness, which is minor tears of the muscles. Typically, this happens when you first start doing activities. Say you're starting to get ready to get back into shape to play a sport. You're going to have a lot of soreness, stiffness, things of that nature. Pretty normal. A lot of the soreness comes from minor muscle tears. Eventually, it's just something you get used to. Okay, then from there, the next step from there, you're going to sometimes get muscle cramps. Typically, muscle cramps are a combination of a few things. One, it might be doing too much too fast. You're not ready for it. Two, and probably the biggest thing is people get cramps from dehydration. They're not taking enough fluids, and if they participated in a game or activity, they didn't drink enough water beforehand and during. All right, things of that nature. Can be very painful. Usually, you can get them to the side, but it's actually probably one of the more, I think, preventable things a person can do. Some people are prone to them, though, I will say that. Strain is an overuse injury. You strain something probably means you've pushed it a little further than it wanted to go. Sometimes it is followed by some soreness and swelling and maybe a little bruising. Typically just a little rest, little ice, little TLC typically takes care of it. Sprains. Okay, now we're starting to get a little bit more of the serious variety of minor injuries. Sprains are an overstretch or tear of ligaments. Okay, I'll use myself for an example here. I've sprained my right ankle twice and my left ankle once. The second time I sprained my right ankle was far worse than the first time I sprained my ankle. Okay, both times, all three times actually, my foot turned completely black and blue. I had a big old knot that looked like a golf ball under my skin. I obviously probably cleanly tore it off. So sprained all three of them playing basketball, so that tells you something too. All I did is I came down, my foot got rolled over a little bit, and basically the side of my ankle touched the ground. These injuries take time to heal. If you do therapy and things of that nature, usually it can help you back. You may need to see a doctor depending on the severity of it. Physical therapy is a good idea. If you're in college, they have athletic trainers that will help you. And like you say here, it can result in swelling and bruising or the combination of the two. Typically, if a kid sprains an ankle, I tape their ankle right away as a preventative measure to reduce the swelling. We put ice on it too to help reduce that swelling. Continuing with some of our minor injuries, we also have tendonitis. Tendonitis is swelling of tendons. This is very painful, okay? I can speak to it. I've had it a few times in my life. My freshman year in high school, I had what they called patellar tendonitis. You know where your patella bone is on top of your knee or your kneecap. Right below it is a tendon that holds it in place. Mine was severely swollen to the point that if I flexed my knee to shoot a basketball or anything, because this was during basketball season, you'd hear a snap and you'd see my leg give out every time. I ended up sitting out with basketball for about 6 days. I got put on anti-inflammatories and I had to see a physical therapist every day for 4 days. I was able to play after that point in time, but I can honestly tell you it was painful. It did not feel good. I don't blame anyone. It was just, I think it was a combination of things in my case where maybe some growth, some age things, but it definitely hurt and I don't really wish it upon anyone. And like I said, this one simply requires rest. All right, getting to some major injuries. Okay, you're going to see a picture show up here. This is a picture of my nephew, and I was going to talk about one of the first things on here. It's called a dislocation, a major injury where a bone is not in its normal place. Doctor needs to put it back in place, okay? The picture here actually is of my nephew's kneecap. If you look at it, you can see the kneecap is completely to the side. All right, that was the first time he did it. He's done it a second time since in actuality. He's a senior in high school right now. He actually cannot play sports for 1 calendar year. He hurt it again, and this was about a year ago in January. He hurt it this past September, and he cannot return to sports till this coming September. It is something that is very serious. You need to get a doctor to get it put back in place. I do have an issue with this one because this should have been handled in a different way, but I'm not going to go into that right now. All right, past that, we got fractures, which are breaks in the bone. They can be major to minor. Some require a full-on surgery. Some just require you just to rest for a few days. Most people will break a toe in their lifetime and never know it. All right. I heard somebody break a toe once right by me. It's a loud thwack sound coming from their toe, and I knew they broke it. And they knew they broke it, but all they pretty much did is put their shoe on and kept on going. There's not a whole lot you can do for it. The only thing is like anything else, it's going to need some time to heal. Teenagers, somewhere between 4 and 6 weeks to heal. Adults, you're looking at 6 to 8 weeks. But like it says there, it needs time, and also it must be set right. That's where usually the surgery sometimes come in, is that they have to sometimes insert pins, sometimes they gotta go in and re-break it and reset it right. All those things have happened before, and there's nothing you can really do about it. Doctors do the best they can, and sometimes people don't realize it's broken and they just kind of go through it, and then all of a sudden the pain gets to the point that they go in like 2 or 3 weeks later, and by then it's started to recalcify. The bone wasn't set right, and then they have to actually go back in a lot of times to surgically break it again so they can set it right. Like I said, may or may not need surgery. You like my spelling of surgery? Stress fracture, you typically hear of people as an overuse injury. I think of baseball players, volleyball players a little bit. Typically overuse injury. Typically happen in like the feet and ankles, are common for stress fractures. Sometimes in the wrists. That's about the only ones I typically hear about. I'm sure there are in other places too. I guess the vertebrae is the other one that sometimes you hear about it. But these typically, there's not a whole lot you can do other than just give them a little time to heal. Usually don't require surgery, and most of the time, a doctor can see them on an x-ray, but they're not the most easily seen thing on an x-ray. All right, last thing is a concussion. Concussion is a very serious topic amongst most people nowadays. I personally think it's gotten blown out of proportion a little bit. And I don't say that concussions aren't serious. I just say that in the sense that it's anytime a kid bumps their head, they want to say there's a possibility of concussion. And to me, there is such a difference. All right, a concussion is an injury to the brain. Here again, you're going to need time to recover. Now, here's where it gets a little more serious, is that if a person comes back from a concussion too soon and they haven't fully recovered, it's like instead of like they say fall and hit their head again in the same manner, the concussion is actually going to be twice, if not 3 times worse, okay? So this is why they want to make sure they're fully recovered before they come back. And that's why I stated on there the injury would be much worse. All right, so that's your major and minor injuries. Okay, talk about some other little health problems that come along with participating in activities all time of the year. Heat exhaustion. Heat exhaustion is more or less thinking your body's overheating, it needs to rest and get fluids. Okay, I've experienced heat exhaustion. I worked for my cousin for a couple of years doing what we call taping and texturing, where you put sheetrock up and fill it in so you don't see where all the seams are between the sheetrock. And we'd always crank the heat up to about 75, 80 degrees in the houses we were working in to help everything dry out quicker, faster, and everything else. Well, I did that for a full day. Didn't drink very much fluids throughout the day, and I actually was sweating like a pig all day. And I got home that night, went to bed. I woke up during the middle of the night with about 101 temperature, just freezing cold. And really what it was is I was experiencing heat exhaustion. It didn't hit me right away. It eventually hit me once I got home. But it is no fun. You think you're just sick and ill, but actuality you're suffering from the exhaustion effects. Heat strokes, also very serious. Actually, you think someone's suffering from heat stroke, they're cold, clammy, very confused, out of it. You need to call 911 immediately. This is something that you don't mess around with. You get them to the doctor, get them the attention they need. Typically, they need to get cooled off. They need IV fluids. They need a bunch of things going on right now. And the biggest thing is they're actually afraid that they literally are going to stroke with their brain, and that obviously is not good. Often will kill people. You got frostbite. Frostbite is just more or less your skin becomes frozen, and it actually acts like a burn. It does not feel good. I've experienced frostbite many times. I probably had a very serious degree of frostbite on my ankles one time. I actually took a warm shower. I think I probably took too warm of a shower because I think it made it worse. And it looked like I had big scabs on my ankle, and they kind of nasty. That's what I said. It looked like they feel like a burn, but in actuality, it's from them freezing. Must be warmed slowly. Might possibly need medical attention depending on the degree that they have. Hypothermia. The body's core temperature is getting dangerously low at this point in time. This means that the individual needs, obviously, to get to a warm place. The problem is once it gets so cold, the body starts to shut down, all right? You get so cold, your heartbeat slows down, your brain function slows down, and basically all the organs in your body just start to shut down, okay? So this is where it gets very serious very fast, okay? You suspect somebody's got hypothermia. They're typically shivering uncontrollably, might not even be conscious. So what do you need to do? The person needs warm temperature, so you get them in a vehicle, get them into a house, get them somewhere, wrap them in a blanket. Okay, if they're conscious, try getting them to drink some warm fluids, all right? Really help promote that internal temperature to start going up, all right? Okay, from this point, I will have part 2 of this next.